There's a trend across this country to have outdoor areas go smoke and tobacco free, and not just on college campuses, but in public places such as beaches or parks, such as Times Square. I've been on campus for over 10 years now as the Director of Health Promotion, and during that time we worked on many health initiatives.
We don't want to disenfranchise students who smoke or faculty staff that smoke. It's not about that, they're bad or whatever. We just want a healthy environment.
I went to school for health education and public health. That's my background. I've worked at different facilities. In 2006, the Surgeon General came out saying that there is no safe level of exposure to tobacco smoke, even outside. And that really prompted a lot of schools to start looking at going tobacco-free.
The only problem I have with smokers is that when I'm walking to class and somebody lights up a cigarette in front of me, it's kind of annoying just to breathe that in, but other than that, it's like not a big problem.
Yeah, it's good for non-smokers, but bad for smokers. I mean, it takes away their rights, sort of. I like the idea about smoking sections, having a legit area where they can smoke.
I always say there's a silent majority that approve it, and the students that approve it don't want to tell their fellow students not to do something. They don't want to be the smoking police, and I understand that. But we have students come up and just like privately thanking us. We're like, would you want to go public? Well, no, I don't want. I don't want to be the one to do that.
They did have a smoke, and we asked them some questions about if they plan on quitting ever, and most of them were like, yeah, as soon as I graduate, so it's still like we can get them now where they can get the products
to
free.
Provide free gumma patches to students and faculty and staff. Also, students, faculty, and staff, if they have insurance, it's covered under insurance, so we can work.
We plan this whole next year, besides an awareness campaign that's coming, to get out information about what support's available should you want to quit. Or should you not want to quit, how to manage your addiction during the day.
I haven't really noticed up till now, so I don't feel like they should. I feel like people are respectful enough to make their own decision and smoke where they want.
A suggestion would be to probably not completely eliminate it, but maybe have smoking sections for those who do want it. For those who want to avoid the smoking, they can just stay away from the smoking section.
And the advantage of then having a tobacco smoke-free campus, if you're walking around campus, you won't be triggered by everybody smoking.
It's interesting because we had the open forums, we had all those things, and we had very few people come to those with any resistance towards it. Then we got ASUO President Amelie, and this was one of her big things that she had wanted to do, and so we worked closely with her, and that's how it kind of came.
Boundaries, what is enforcement, all those things we're looking at, and we have 3 work groups going off of that for enforcement, campus boundaries, and marketing communications. We feel like if we have a strong marketing communications campaign, that will help us tremendously when we go live next September.